Our first speaker is Ron Sabar from Israel, founder and chief medical officer of Sabar Health. He will speak about new frontiers of home hospitals. Hi, Ron. How are you?
Hi. Morning. Perfect. Thank you. Thank you for having me. I hope you can hear me well. I definitely would have loved to be in person in the Czech Republic, the beautiful Czech Republic, and not here from my home. But maybe, hopefully, one day we will. I will talk today about the importance of hospitals at home as a new frontier for taking care of patients in the coming eras. And I think if I had this talk 200 years ago about the importance of taking care of people in their own homes, you would have probably looked at me and said, what a completely irrelevant talk. It's pretty much like talking about the importance of breathing, because until about 200 years ago, that was the only place where you would take care of patients. I mean, from the moment that the first man in the first cave met the first shaman and said, it hurts, and he took care of him, up until 200 years ago, people had the majority of their health care being taken care in their own homes, in the comfort of their own homes. Now, hospitals have been around since the days of the ancient Indian Empire for many thousands of years. But all throughout the eras, they were pretty much more like religious institutions more than healthcare institutions. You would go there because you were either dying or society has driven you out, like in the case of leprosy. And it wasn't until about 200 years ago where a famous pioneer, which all of us who know Florence Nightingale as the mother of modern nursing, few of us know that she and Thomas Percival are also the parents of the modern hospital care as we know it today. And what happened in the last 200 years is that the pendulum of the focus of center of care shifted entirely from patients' home to clinics and hospitals. And we today, there's a large movement of us who believe that the future of home or future of hospital, or rather the future of medicine, is going back home or is going back to the home of our patients. And pretty much like the biggest taxi company in the world has no single taxi of its own, which is Uber, and the largest hotel chain in the world has no hotel room of its own, Airbnb, we predict that in the very near future, the largest and most comprehensive hospitals in the world will not have a single hospital bed of their own. We will be taking care of our patients only in the comfort of their own private homes and beds. And just to give you an idea, I founded Sabar Health in 2005, and today we're the fourth largest hospital in Israel as far as beds are concerned, and we're nationwide as far as service. So the future is pretty much here. Just a few words about what the COVID pandemic had done to the concept of hospital at home. Is essentially what it did is it took out the question of why from the equation. Because up until 2 years ago, people still asked, why do we need hospitals at home? And what the COVID pandemic did is people no longer need to ask, why is it good to have an alternative to going to a hospital? Because during the pandemic, hospitals did their entire best to explain to patients why they shouldn't come to the hospital. And for some, in one point or another, our main diagnosis of accepting people to hospitals at home, where the number one reason was we do not want to go to the hospital. Not cellulitis, not UTI, not pneumonia, not any other diagnosis. It was just refusal to go to the hospital. So since the pandemic, nobody asks anymore, why do we need hospitals at home? Now, 2 words about the Israeli healthcare system. It's a very socialist in the care, in the essence of it. 100% of the population is insured. You cannot be uninsured in Israel. And when we compare healthcare systems around the world, we usually talk about the payer, the provider, and the insurer. So the payer is essentially from the public pocket, from the Social Security payment. The insurers are 4 HMOs, health management organizations, and they're essentially also the main providers. And we established Sabar Health in 2005, as I said, and we started off essentially as a home hospice service. And today, in the sense that all patients see physicians, nurses, and social workers, not just nurses. So we are the largest home hospice service who is completely physician-based service and not just nurse-based service. And we treat about 850 patients in any given point of time, end-of-life patients. But what happened with time, with the years, is that we realized we're not just a home hospice service because we take care of our patients 24/7. We have full accountability of their health care. We have multi-interdisciplinary team going into their homes. We have a united emergency electronic medical record. In a sense, we're a hospital at home service. And the second home hospital ward that we established was rehabilitation, because at least in Israel, there's a severe shortage of acute rehabilitation beds, especially when you go into the periphery of the country. And what we did is take patients who needed acute rehabilitation, whether it's after a neurological event like a stroke or an orthopedic event or an accident or deconditioning, and we're doing the entire rehabilitation in their own homes. So except from physician, a nurse, and a social worker, also physiotherapists, occupational therapists, speech therapists, and dietitians go into the patient's home. The third ward that we opened a few years ago was internal medicine, acute medicine, where essentially we're a substitute for being in a hospital here and now in an internal ward. Usually the average stay is for 3.5 days. And we're talking mainly infectious disease, acute infectious disease, but also COPD and CHF exacerbations, and even neutropenic fever patients while getting bone marrow transplant. So this is a very intense unit. And the last unit that we opened 2 years ago, which I'm very proud of, is acute psychiatry for patients who need to be hospitalized in an acute psychiatric ward, and we take care of them in the comfort of their own home. All in all, as I said, about 1,300 patients in any given point of time. Again, the fourth largest hospital in the country. We're not a classic hospital at home service in the sense that we don't belong to a hospital. We're a private organization, but the entire service is paid out of the public pocket. So this is a great example of a potential of a public-private cooperation where the provider is private, but the funding is completely public. What happened during the pandemic era? So at first, we had to make a strong decision that we continue on taking care of our patients in their own homes. And I will take you back a year ago. That wasn't a very trivial decision to make. Nobody knew anything about the pandemic. We had teams and staff that were very afraid to go into patients' homes. And we had patients that were afraid that the teams will go into their homes because they knew that the teams were going from home to home, and they were afraid maybe they're going to be contagious and bring the pandemic with them to our own home. So that wasn't a trivial decision to make. And also, as was mentioned, there was a huge shortage of personal protection gear. So it was a very difficult decision to make, but we made a very distinct strategic decision that we will continue with the same service level agreement, and we'll go on to visit our patients with the same frequency that we did before. And what happened was the impact was tremendous, because for many patients, for a few months, we were the only human contact that they knew aside from seeing family members via Zoom. So the human contact, although protective with body gear, was very, very important to keep the safety, the mental safety of our patients. Now, the HMOs organized themselves very quickly for monitoring patients from afar. What they did is sent each patient a pulse oximeter kit, and patients had to report every day about the respiratory rate, their blood pressure, and the pulse oximetry. And so tens of thousands of patients were monitored from afar, just from talking to them and from them reading out their results from the simple medical devices that they got. But once you had to go into the patient's home, the HMOs were completely clueless on how to do it, and then they used us for that. And first, what happened, the first wave of patients that we got were patients that were non-COVID, that just were let out of the hospital with infectious diseases, with COPD or CHF exacerbations, and the hospital just said, you have to get out of here because we don't know what wave is coming. The second wave we got was of relatively light COVID-19 patients, and at the end, we were dealing with very severe COVID-19 patients, those patients who decided that worst case scenario, they will die, but they would rather die at home and not in a lonely hospital bed. So that was the shift in patients that we saw during the entire pandemic. Now, a few key lessons that we learned from the last pandemic. One is that technology is important, but it's not the main factor of success. And it's a very common mistake to assume that home hospital or remote hospital equals definitely technology. That's not true. Technology is an important tool, is a crucial tool, but it's just one factor. It's much more important, and the success rate of hospitals at home is much more dependent on personal contacts rather than on technology. And unfortunately, as of today, even though there's a huge hype on remote and telemedicine and sensing equipment, up till today, to this morning's talk, there's not one product which is over the shelf, easy to use, plug and play, which really gives an added value both to patients and to team. If they were, I would buy 1,000 pieces now, but unfortunately there isn't. It's either too technological in the sense that it throws hundreds of gigabytes of information in any given point of time, very accurate, but completely useless to the teams, or it's very cumbersome and difficult to use for the patients. So as of today, there is no product that we can really use successfully in hospitals and home as far as remote monitoring. What we believe we should do is for technology companies to focus on predicting real life short-term events, in the sense that it doesn't give me any more information to tell me that the patient has fallen now in his home. But if you have enough AI and enough sensing to tell me, take care, go and visit him, because in 2 more days from now, there's a high risk for him falling, even in the next hours, that's a very crucial information that I can use. So what I'm saying to technology companies that are looking into this field, look at predictive information and not something that will tell me what's coming in the here and now, because by definition, very sick patients who need online monitoring will not be sent to home hospitals. The other thing is that there's a huge demand for point-of-care testing, point-of-care blood testing, and point-of-care ultrasounds, for example, to replace X-rays machines. Now, the most important thing about future development is that all future developments in technology must look at the home arena as the future of home care, but do not develop products which are only for the home environment. What I'm saying is that the best combination is to look at technological improvements in the field of healthcare that are both for hospitals and for the home setting. The more the medical personnel society will be used to using these technological advancements, even in the hospital setting, they'll be more ready to send patients at home and use these same technologies in their home setting. So that's the most important point as far as technology is concerned. Generally, about the future of hospitals at home, what we learned from the COVID-19 is that it has to have a serious governmental involvement in the sense of regulation, of criteria, and on funding. And the most important point is an accreditation. If you look at a hospital at home, you must look at it as seriously as you look at any other hospital. Same criteria, same accreditation, same seriousness as you look at it. And when we want to draw the best staff, the best personnel to come and work at home, we need to offer them the future of personal development as far as research, academic involvement, collaborations, and what I suggest is the same achievement that we had last year is that our home hospital service was accredited as a place where people who want to specialize in palliative care medicine can specialize in the home setting, which is a revolution, at least in Israel. So what I'm saying is that if you truly look at the hospital home as the next frontier of hospital care, then you must involve the training of physicians, nurses, and other healthcare personnel fields in the setting of the home care, which means that let's say, specializing in internal medicine or rehabilitation or neurology or geriatrics, part of the 4-year training of being a specialist in this field has to involve at least 3 or 4 months in home setting. That will be the true future of hospitals at home. And the last thing I would say, because my time is up, is that hospital at home is also an opportunity. It's opportunity in the general level, in the country level, because this is where the hospitals are going. This is where the healthcare is going. The model of brick and mortar hospitals is not sustainable anymore. Population is growing, it's aging, healthcare needs are growing, and the idea of bringing people into a brick and mortar building and taking care of them only there is proven to be problematic, both in the autonomic and ethics of patients, but also as far as healthcare is concerned, because there's a higher risk of falling, of cognitive decline, and acquiring antibiotic-resistant infections. And also in the economy aspect of it, is just not sustainable economic-wise. But also in the personal level, it's an opportunity, because all healthcare personnel who try once taking care of people in their own homes see that they fall in love again with the reason of why they went to study medicine or nursing or social working or physiotherapy. Because it's once again the opportunity to do exactly why you joined this profession. And they realize that instead of going to a hospital, taking care of patients, they go to people's homes and take care of people. So I hope this was a very short but comprehensive and clear enough understanding of what we did as far as hospital and home during the last pandemic crisis.
Indeed, it was. Thank you very much for the interesting ideas which you put on table. I hope that in a few years we could meet in Olomouc and we can discuss some of the solutions. Person behind the different annual conferences of International Days of Science has been Jarmila Cimrmanová, current rector of Moravian Business College. She will speak about current challenges for multidisciplinary approach in socio-economic research.
Thank you, Tomas. And at the beginning of my presentation, I would like to thank previous speakers, because it was really interesting, and both presentations were perfect for me. So as Dr. Sabar said, I hope that next year we will have the possibility to meet here face-to-face, because besides technology, personal contact is important. As introduction, I prepared for you some pictures of our school, and I would like to point out this building where currently we are, and the conference takes place. And I would like also to send warm greetings to all our partners who are seeing this conference, and I hope that next year we will have the possibility to meet here. So thank you for support of our education activities, of our research activities, and for mutual cooperation. And now move to the main topic of my presentation. It's a multidisciplinary approach, and I would like to start with impact of COVID on research activities. The key question is, have scientific research activities been affected by COVID? I used the most famous scientific database, Web of Science, and I did bibliometric analysis, and you can see that in year 2020, more than 77,000 of records connected with COVID were published more than 77,000 scientific papers and outputs from scientific conferences connected with the keyword COVID. In year 2021, you can see that currently in April, it's more than 25,000. So the COVID definitely involved research activities, and we can answer that yes, it's clear COVID has impact on research activities. The second question is what is the impact, in which way the COVID influence research activities. The first is methods of work of researchers, and the second is research topics. Regarding the methods of work of researchers, the key tool is digitalization. As Deputy Minister Martina Tauberová said, digitalization accelerated both communication and education activities. And regarding researcher works, it's also project management and methodological approach. So all of these communication, project management and methodological approach are influenced by digitalization and online tools. Regarding research topics, we can see that the pandemic affects the perception of society, and the researchers focus on COVID attitudes in almost all areas of research and development. You can find various kinds of analysis, ex post, ex ante, or prevention analysis, which are connected with COVID and socio-economic disciplines. Regarding digitalization, I would like to focus in more detail in such a topic. As I said, we can see great acceleration in the use of technology, also in non-technological disciplines, then digitalization in education activities, and new forms of working online tools. Here there are various connections of digital transformation or digitalization with different scientific fields. You can see, for example, there is sharing economy, sustainable development, business models, e-commerce, industrial policy, consumer behavior, or for example, information system or e-health, e-government. So digital transformation, digitization is everywhere in all scientific disciplines. Regarding interdisciplinary cooperation, I would like to show you more details about our project Spatialomy, and it's also invitation for a special session, Spatialomy, which will be after this socio-economic session. Regarding our project Spatialomy, the Czech National Agency ranked this project among the top 7 fields of international cooperation implemented within Erasmus partnership. And this project was presented in Bologna as example of interdisciplinary cooperation. The Spatialomy project is based on interconnecting of various disciplines, precisely geographical data analysis, economic data analysis, and IT. Here you can see some numbers connected with the Socio-economic project. On the one side, there are outputs in education, and on the second side, there are also outputs in research. For example, we had more than 20 scientific papers, one Socio-economic proceedings, and one Socio-economic book included methodological inputs and also scientific chapters. There are some pictures from our project, and regarding project management and methodology, we used blended mobility and cross-border cooperation, virtual meetings, and also new technologies and digitalization tools. There are some colleagues from this project, and today you can hear presentations of these two guys, Dr. Pasto and Associate Professor Burian. We are, as Jitka Lidařiková, our Vice Director, said, there are interconnections of various disciplines in the second Socio-economic project, geomatics, economy, business informatics, and game studies. And now I would like to show you the very interesting Web of Science tree map connected with keyword COVID. You can see 20 scientific disciplines with the most frequented papers with keyword COVID. And besides medicine and healthcare scientific discipline, you can see also business economics, psychology, ecology, and education. So COVID influenced not only medical and healthcare science, but also socio-economic disciplines. Regarding innovation and sustainability, I would like to underline, because I have not so much time now, I would like to underline that COVID accelerated innovations. And as Lindsay Fabiano, healthcare strategist, wrote, the global pandemic accelerated 20 years of innovations for the healthcare industry into 8 months. And in my opinion, it's not only in healthcare, but in all disciplines that COVID is an accelerator of innovations. Here is the last tree map, socio-economic and COVID. You can see also the specific scientific discipline connected with these keywords, socio-economic and COVID. And also besides medical care and healthcare, there are socio-economic topics like business economics, ecology, education, and psychology. What is important, it's a multidisciplinary approach and connection of specialists from all of these scientific disciplines, because cooperation of this specialists can create new solutions and innovation. Like McKinsey Global Institute wrote, the crisis sparks a wave of innovation and launches a generation of entrepreneurs. And examples of current socio-economic issues which should be solved are connected with labor market changes, fiscal policy, and also state and municipal budget changes, business plans, and optimization. And as I said before, healthcare services digitalization, but also it's connected with behavior of consumers and households and online customer service, for example. We need disrupted and out-of-box thinking, creating multidisciplinary teams, and this connection will bring us new solutions and ideas. And as a conclusion, I would like to underline that digitalization is everywhere. And it's not necessary to be physically at a specific place. It's also the case of our conference that it's not necessary to be here, but it's better to meet personally. The second, various online tools enable us to share the knowledge and also the ideas and innovation ideas. And the last, that the COVID crisis is a huge accelerator, and it's accelerator for research and development, innovation, optimization, and new ideas. So thank you very much for your attention.
Thank you very much, Jarmila. What I can promise is that we will still try to be more disruptive than what you have seen so far in our first session. So I'm happy to welcome here Linda Stutzbartová, my colleague from Czech-Israeli Mutual Chamber of Commerce. She will present the case study on soft diplomacy about experience of the chamber to help to the Czech state institutions during the COVID-19 crisis. Hi, Linda. Good regards to Prague.
Everyone. And the sentence that is opening every session, I hope you can hear me. I hope you can see me. Soon I'll be starting my presentation. And right now I am experiencing a big techno stress. So please bear with me. It's another phenomenon of COVID. So my name is Linda Stutzbartová, and now you should be able to see also my presentation in the full mode. And I am executive board member of the Czech-Israeli Chamber of Commerce, and I'm also a co-leader of our Committee on Science, Research and Innovation. And I like to call myself practical academic because I believe there is nothing practical than a good theory. And as a founding theory, we can actually start with the Israeli triple helix innovation model, which I found very useful. And basically, Israel is successful because they have effective functioning of government support, strong academic institutions, and supportive private sector. And I would like to show you how Czech-Israeli Chamber of Commerce can become your partner, as it has become a partner for many institutions and organizations in fighting the pandemic and in bringing our cooperation to the next level. Because Israel is for the Czech Republic the third most important partner from non-EU partners. And there is a big potential for cooperation. So let me say a few words and introduction of the chamber. We have been existing for more than 26 years, and I'm proud to say that we have become a relevant partner and respected partner to the highest levels of executive and legislative bodies. And our mission is to support business, connect nations, and create values. What does it mean in practice? I would like to say that I consider Czech-Israeli Mutual Chamber of Commerce one of the most established and also active chambers of commerce in the Czech Republic. We work in 4 sections. The first one deals with security and cybersecurity. The second one deals with science, research, and innovation. Then there is a digital economy and trade section. And last but not least section, smart healthcare section. This is actually chaired by Tomáš Jelínek, and it became truly relevant with regards to fighting COVID pandemic. if I may use the management terms, we also take care of succession planning and talent management because we have student section Gesher, meaning bridge. And I would like to also thanks for the close cooperation to our embassy in Tel Aviv, to the embassy of Israel in Prague, also to partner organization of Israeli Chamber of Commerce in Tel Aviv, and to Ministry of Industry and Trade and Czech Trade. So these are all institutions that we closely cooperate with and that support our mission. So how do we support business? It was already mentioned that it all starts with connections and with personal connections. So we have traditionally been the co-organizer of entrepreneurial missions to Israel. The last state visit to Israel of President Zeman was accompanied by a significant number of entrepreneurs in 2018. We also were organizing expert missions, Cybertech International Homeland and Security Conference, WOTEC and Biomed conferences that usually serve as a good place, not only for inspiration, but for making true connections and partnerships. We have organized webinars, workshops, and innovation days. And I'm also proud to say that these had regional character. While Finspiration was in Prague, Innovation Day on Smart Healthcare were held traditionally in Olomouc in 2019, virtually in 2020. And last but not least, talking about values, the Chamber has been organizing the Arnold Lustig Award since 2011, because I think values are also relevant in this era. How to stay connected during the pandemic? Well, Israel went online. Actually, Israelis are quite used to working remotely and establishing partnerships and even important deals remotely. There is a term for it, merger and acquisition in flip-flops, for all the important deals that were secured from homes during the pandemic. So we as a chamber also went online. We organized 9 webinars only last year to raise awareness about current possibilities of cooperation. We brought the best practices from Israel regarding e-health, digital health tracing and triage. These were the most important topics during the first wave. And of course, we concentrated on vaccination and treatment during the second wave. On top of that, we organized expert debate. We provided guidelines for politicians and decision makers and direct connections to the best experts in Israel. And again, a big thanks for Tomasz Jelinek and his role who played. And it's not only COVID and health, as we heard from Mrs. Simeonova and also Mrs. Tauberova, it's affecting the whole society. So we also concentrated on other issues. I would like to underline assistive devices, violence prevention, artificial intelligence, support to SMEs, transformation of large corporations, because suddenly even large corporations had to start to work from home and had to adjust to these situations. And we sort of all the time were bringing the best experts and the best knowledge from Israel to partner with our Czech counterparts and hope that the inspiration will bring some future, more sustainable collaboration. What else we did? Well, the charity Arnold Lustig Award promoting courage, bravery, humanity, and justice was redirected to help the pandemic. The chamber donated more than 600,000 crowns to Czech Technical University to help provide protective gear to medical personnel. It was during the first wave. But also all our members help in their capacity. And it's also great, I spoke about the regional character, which I consider very important, that not only in Prague everything is happening, that all companies helped in the regions. I could mention the Lipo incubator from Liberec that was giving free consultation for startups. Deconta was disinfecting public spaces. Meopta provided free printing of face shields. Respilon donated top respirators to Hagibor Elderly Senior Care Facility. Orcam allowed free use of their assistive cameras to visually impaired people that suddenly were stripped of any assistance. Tesco Software from Olomouc, many thanks for 3D printing to fight COVID-19. And Teva, more than 8,000 liters of disinfectant donated to hospitals and institutions providing senior care. So I believe that we fulfill sort of the mission of anyone and waiting for the new normal. Well, we still function virtually. This first part of the year, we have raised awareness about best practices in Czech Israeli business and also in the area of applied research. We also help to provide some subjects for cooperation during Prime Minister Andrej Babiš's visit to Israel, because at that time we could not accompany him. We provided spring webinars. It's a series that's available as videos. We informed about new program to support small and medium enterprises. It's called Propea, and it really should help establish companies on Israeli markets. And the Ministry of Foreign Affairs is paying about 70% of costs. We further support scientific collaboration, and we concentrate on publishing best practices in Czech-Israeli intercultural communication. We held a virtual B2B business forum because the commerce cannot stop, the cooperation cannot stop. We organized this with the main Chamber of Commerce in the Czech Republic, and I'm very proud to say that 40 participants from both countries took place and had bilateral one-to-one meetings, albeit virtual. And it was the most visited webinars of this sort. So I'm glad that the cooperation is going on. And as I mentioned, we have series of best practices published online. I also mentioned the regional character. So Liberec region is waiting for nanotechnology days in 2022, because this we decided cannot go virtual. And I am very glad that actually Olomouc and Moravian Business College, that has been a long time member of the chamber and very active member of the chamber, will announce next month Czech Israeli Innovations and Partnership Center. I'm very glad that the initial innovation days on smart healthcare are now turning into a platform that will truly enable strategic partnerships and also working on solving specific issues. This center has received the highest level of patronage, and more information will be available in May. So congratulations to Moravian Business College, and thank you very much for being leader in this area. What are other areas for cooperation that I see between the Czech Republic and Israel? Because, I mean, COVID is only one thing, but that doesn't mean that other problems have disappeared. It's Industry 4.0 with the focus on smart production, as Mrs. Tauberová mentioned earlier. For the Czech Republic, water and drought very, very big problem. E-health and digital health as an opportunity. We have fintech area for cooperation, nanotechnology, cybersecurity, smart mobility, more applied research and innovations projects, small and medium enterprises and their transformation with regards to Industry 4.0. Improving conditions for large companies, I have already mentioned that. And last but not least, student cooperations and exchanges. We need to have more accelerators and joint competitions. So the Czech-Israeli Chamber of Commerce is here for you. Please, if you have joint projects, if you have successful projects that you would like to scale up, let us know. We are here to help you. We are here to connect you. What I have realized is that Czechs have as many good ideas as Israelis, but sometimes we need to learn how to sell them better. We need to them help us to promote better. We need to find the right partnerships to scale up. And the Czech-Israeli Chamber of Commerce is here for you. So thank you very much for this opportunity to speak to international audience, even though I could not travel to Olomouc because I am myself recovering from the COVID-19. And I wish you the best of luck with the conference and hope to see you soon in person. Meanwhile, let's keep in touch because the virtual contacts can be also very functional. Thank you and have a great conference.
Thank you very much, Linda. I'm happy that you overcome your technology stress. So next greetings go to Dublin, to Lucia Morales from Technological University Dublin. Lucia will present her research, The Reality of Global Imbalances and COVID-19. In the number of poets and beer lovers, there are no significant differences between the Czech Republic and Ireland. We will see what Lucia thinks about that. We cannot hear you. Lucia, we cannot hear you. So, honestly, it's usually better to have conferences in person that you can better hear and relate to the people. You don't have to deal with the technology stress as Linda mentioned. I must say that so far we have most of the presentation which we had were related to the sort of disturbing the standard economic and business lectures. So now we are coming back on the ground. And I'm again introducing Lucia. I hope now the connection is okay. We still cannot hear. So I'm asking to the regie if we should go with the next presentation, and you will solve the technology issue with Dublin. I cannot hear you. So, should we go with the next presentation?
Can you hear me now?
Yes, we can now hear Lucia. Very good. So we are back in Dublin. So we stay with the program. Sorry, Lucia, for that stress.
The audio, apologies about this. It wasn't connecting.
So please, floor is yours.
Thank you so much. And very stressed now with the whole audio thing. I hope you can see my presentation. So what we're talking here is a little bit connected, or maybe a lot connected with some of the discussions that has been going on since we started in the morning. But I want to bring some reflection in terms of global imbalances and the problems that we're facing. Like, there is no doubt that COVID-19 have disrupted the way that we understand our society, the way that we understand our economy, but also the way that we understand how our global economy is characterized by its imbalances. So as you can see in the title, the presentation is about the reality of global imbalances and then in which way COVID-19 might have contributed to visualize them. So the picture that you have there kind of highlights that. Are we considering these in terms of the global scope and the implications? So I will start giving you an introduction to the theme, and then we will kind of have a little bit an interaction with different economic and different COVID-19 information that there is no doubt is dominating our environment and our worlds since last year. We will look at poverty and equality, and we also will consider in which way we're confronting these challenges. So how did we start it? So I think I try in this to kind of reflect a little bit on the nature of the crisis and also on the way that it was handled. And I will be a little bit critical in terms of the international response to it and the way that global economies that were supposed to take a leadership approach reacted to it. So COVID-19 have a kind of a learning period there because in the Asian region, they were exposed to acute respiratory syndromes back in the 2000s. So it's not that new, and researchers has been warning about this type of pandemic coming. We have historical records on this. What makes the difference is that as SARS erupted back in the 2003, the main affected were the Asian region. So there was a learning process that has materialized as we have experienced at the 2000 or 2019 starting point, where Asia appears to be more prepared to deal with the situation. So we know that it started in Wuhan. We know that it was communicated to the world around December 2019, January 2020. And there is where the problem started, with the disconnection at a global level, with the World Health Organization and Chinese authorities having conflicting views and having a little bit that disconnection in terms of telling the rest of the world what's going on. And then we see from the US, that traditionally has been a leadership economy, accusations like coming from the Donald Trump administration that this was a Chinese type of virus. Somehow it wasn't taken as serious because it was kind of this belief that was maybe there in the region and it wasn't going to affect the rest of the world. But the warnings were down there. Then we start to kind of worry a little bit when it hits Europe and it starts in Italy. And we saw then that there was that reaction towards, well, this appears to be a worrying situation. But again, we were witnessing what was going on in China, and no real measures were taken at the international level. And we have, again, previously that Asian experience that could be of help at the time. Then things like economic lockdowns were taken into consideration to deal with a health crisis. And this was somehow a mistake as well, because the economy was ignored. There is no doubt that we were in an uncertain situation and we have to deal with it. We have to learn from it. But economic hibernation have proved to be a major mistake, because there are examples of economies, of regions, of areas that have not entered into those economic lockdowns, that have successfully managed the situation, COVID-19 spread, and so on. Then we can look at what has been the role in here. What might be wrong? Then why the US maybe didn't lead as we are kind of used to see? Are there some kind of distinctions in terms of political frictions, economic power, political power, diplomatic type of approaches? And a lot of damage has been done by the populist governments that emerged as a result of the 2008 global economic and financial crisis. And we can see that damage in the way that COVID-19 has been handled. Something for us to consider is this is COVID is impacting the world economies. And amazingly, the world economies have not managed to cooperate and to show that leadership, and more worryingly, those kind of developed ones that have taken that stance previously. Then as we move towards the impact of COVID-19, we see that, again, lockdown measures, economic lockdown measures have created a lot of damage. The first speaker from the Ministry of Industry and Trade in Czech Republic have highlighted like the economic dimension of it, and still we don't know how much damage has been done and the way that these have to be managed, because there is, in that context, we don't have much information yet. But what we know is that, especially from previous crises and the 2008 financial crisis, is governments and organizations like central banks and so on, intervention is in order to stimulate the economy and to help recover has been critical. And we will see a little bit later why this is important, in which way the mechanism, the economic mechanisms that has been frozen required to be like more active in dealing with the situation. We also have problems at the moment with regard to the vaccination programs and the way that the vaccine has been developed, the way that the vaccine is being distributed, and again, the lack of international cooperation kind of emerging as a major area of concern. So as we look at some of the images, as the vaccines were announced back in November 2020, and the world started to take a little bit a more positive approach, especially the developed economies. What we can see in these pictures is that the situation was quite dramatic back in December, so that you can see here how these numbers were kind of on the top. But if you pay attention to our current figures, you can see that we have crossed that line that was very high back in December, and we're moving into very worrying numbers. And the situation is now being marked by less developed economies. So right now we have those informations back to 2020 of what was going on, because the developed economies were showing that they were hit, and then we were into that race of finding the vaccine. But now the COVID-19 is hitting the less developed economies, and there is where we won't have a lot of information, because most of those countries won't have like even the mechanisms to record the cases, to do the testing and so on. So we won't know the magnitude, the full magnitude of the impact. You have here like advanced economies and the daily cases, and again, the worrying patterns. Even though populations are being vaccinated, you see countries there that are showing that upward trend. And you can see, again, like if we look at the case of France, you can see the line going up. If you see, again, the case of Italy, Spain, Germany, those cases are on the rise. So even though we have the vaccines, is showing as well that there is still a need of time to adjust. And even though you're vaccinating, that doesn't mean that you are just immune to the disease. There is evidence now that people vaccinated are even positive to the virus and entering into complicated situations with that. Then we have the BRICS economies, emerging economies. And look at the situation there in Brazil and also India. India is in the media at the moment. You can see how the cases are on the rise. And this is a country characterized by high levels as well of poverty. And again, to which extent this is reflecting the reality of the country. If we look at Latin America, look at the numbers in Argentina, look at the situation in Pakistan, that's quite interesting because it kind of shows that it's very stable. But here is where we should be worried, how realistic is this? Because are they really reporting those cases? Are they reporting on the deaths that are taken as a result of the pandemic? You see that the message overall is those countries now, the less developed economies, are starting to feel the impact of COVID-19, and we don't know how much that impact is. Then we move from COVID, so we're just moving into that situation. The virus is here. The virus is not giving us respite, even though we're taking maybe a comfortable type of approach because we have the vaccines and so on. But what the pictures are showing us is, look, the less developed world is not at the same pace. And we need to be conscious of that because the majority of the population will be on those countries. Then have an impact or having an insight in terms of the economic impact. At global level, unemployment levels has been on the rise. So you can see that in this graph. And you can see the case of the US, for example, dramatic rise and quick kind of recovery. One point that I would like you to pay attention is the euro area, that is this kind of purple line. And you can see that while if you compare it to the US, dramatic increase, but quickly moving down. And if we look at the situation there, the government moved after the Biden's election very quickly into a massive stimulus program, mirroring what they did back in 2008. They move on to reinforce, reactivate, stimulate economy. And when you compare that with our case in Europe, we have been into a kind of lethargic type of approach. Again, no coordination, no real insight on what is going on. And we can see that in terms of unemployment. While the other countries are showing that downward trend, Europe is showing an upward kind of movement there. And these worries from the economic point of view that we might be moving then towards those structural unemployment issues. And it's going to take us longer once we know, okay, here is the branch of the economic crisis, how we're going to get out of it. And again, we have 2008 that taught us if you move quickly and reactivate the economy, you might move out of it quickly. And that wasn't the case when you do Europe versus the US, and we seem to be entering into a similar type of road with the management of the health crisis. In terms of GDP, again, another revealing picture here, while you see other developed economies in Q4 reporting positive rates. Look at Eurozone there, look at the Euro area, we're in the negative area. I put this picture here, the global exports, just to show you as well, the comparison with the global economic and financial crisis back into 2008 and our current situation. So what we can see is that exports has been badly affected, but not as bad as it happened in 2008. If we look at commodity markets, then one that was massively hit was the oil market, as you can see here, and then aspects in terms of the stock markets and the movements from major investors and the movement in terms of capitals. And those rich investors are reflected here. There is a clear disconnection between what is going on in the stock markets in terms of wealth implication and the economic reality. So you can see things like the equity indices marking historical highs, for example, in the United States. You see here that back again in March that I was referring to, once the virus hit Europe entering through Italy, we saw a massive decline in terms of the stock markets that afterwards just recover very quickly, and since then they have been just on the rise. An important element as well is what is going on with the gold market and Bitcoin. Bitcoin, as you know, is a little bit quite uncertain too, and an opaque type of area. And you see that is hitting again highs, boundaries over there. And then the impact that is happening then across countries, it's like very, very different. We have a situation where the richer people are getting super rich, and we have situations where, again, the poor are the ones being badly hit, and younger people. So future generations are being badly damaged by COVID-19. And this is something that we need to consider carefully, because these are our future. These are the people that will be running our economies the years to come. So to which extent maybe these vaccines that are now available are contributing them to that poverty inequality and to the economic divide that we're seeing, while developed economies might do better, and when we have the less developed economies doing quite bad. So to which extent the world might have understood that vaccines might be seen maybe as a public goods, and that the idea, as it was mentioned, and you can hear it in the media, that until we're not all vaccinated, and this is a global approach, the virus series is not going to go away. And then you can see then the waves, and this is coming from the World Health Organization, raising concerns in terms of developed economies approach and less developed economies approach. Something that I want maybe to highlight is within those developed economies, how we are looking as well to domestic inequality, poverty levels, this kind of discrimination, deprivation, and so on. And as an example, we can look again at the world's first economy that was badly affected by COVID-19, with a massive impact in household incomes. There you see that about more than 1 billion people has been pushed into poverty, and look at the countries that are being affected, again, mainly those less developed economies. But don't forget that developed nations have also a problem in terms of poverty and in terms of inequality, and this is something that is going to impact that economic recovery, and as well how society emerged from the virus. So countries like the United States, India are the ones that are reporting the most cases. And in here again, how we look into these when we consider less developed economies. Again, is the United States really the economy around the world with most of the cases? What is going on in India? What is going on in countries like Pakistan? What is going on in African countries? So this is a reflection in terms of, okay, they are able to report it, they are able to test it, but those less developed economies do not have a strong health system, do not have the testing system. So again, that just raised some questions. If we look in terms of projections from the IMF in terms of the economic recovery and the potential of a profound recession, what I want to show you is the place that China have there. Every scenario considers that China will have positive economic growth, by the rest of the world developed economies are moving into that negative area. So what do that say to us in terms of global economic restructuring, and again, the positions, the leadership positions that different countries will play as the outcome of COVID-19 that is acting definitely as a break point in terms of those dynamics. So these kind of discussions and figure lead us to, okay, what has been as well the implications in terms of education, and why should we worry about this? Because education, poverty have they move into a vicious cycle, and they contribute again to that global imbalances. So we can see here that education has been massively impacted, and we can start reflecting as well where in that picture we place those less developed economies, and where in that picture do we see that cooperation in order to deal with these problems. Back towards vaccines now. who are those countries that are players in terms of the vaccines? So the developers of the vaccines are the developed economies. The ones that are ordering the vaccines are mainly the rich economies. Those that have high incomes, as you can see here, are the ones that are having access to those vaccines. Again, what that tells us regarding the future after COVID is there is, again, a kind of review of how the global economy is doing. And finally, the market commitments. So once more, you can see that high income dominating there for all those that are developing and producing and distributing the vaccines. So that again brings that clear picture in where are we placing in this discussion the less developed economies as we move into that effort to regain some level of normality. And the challenges ahead, we again, back to this picture of unemployment, where we're going to be if we look at Europe in that recovery of people returning to work and making sure that we're working together towards that economic recovery. Are we heading towards a deep recession because there is that lack of coordination, slow responses in terms to stimulate and reactivate economy? The global GDP, so once more, pretty clear that countries like China seems to be doing quite well. And China is a country that over the years, if you analyze different crises, like back at the 90s when we had the Asian crisis, back at the 2008, China is one of the countries that remained kind of less affected by them, and the government have kind of implemented fiscal and monetary stimulus programs back at them in order to stimulate and protect their economy. And that seems to be working. Look at that line there, like China is differentiated completely from the rest of the developed economies that you have here. I say rest of developed because there are discussions at the moment. People don't know where to place China, and some argue that it should be considered a developed economy, that is not an emerging economy anymore. So again, pay attention to the euro area with that purple line going down and combined with that unemployment rate on the rise and those structural issues. And the challenges ahead are many. And again, one that I personally worry about is this issue of education, the lack again of resources towards those countries that concentrate the world's population, like big numbers there, and that where progress that was made in the past reducing poverty levels are probably being badly affected by COVID-19, and where we see like the big difference in terms of the support that we will get in our countries, developed economies, and those that are not at that level. So what is the conclusion? So we're definitely facing a situation where the world is not as the first picture that you see there, that ideally we should be collaborating, cooperating, and working together. We just have a very divided world. COVID-19 have brought like a lot of challenges, and one of them goes to the political arena, the manipulation of the virus in some instances to justify like maybe incompetent responses to the virus, manipulation in terms of restricting freedoms, social liberties, and also impact in terms of how governments has viewed or introduced regulations, that there is no doubt that some of them has been working hard to protect citizens, but there is no doubt either that some of them have taken advantage in order to reduce freedom and in order to impose certain ways of doing things that the population might not accept if we were in a different scenario. There is a clear disconnection between the way that health should be managed and the way that the economy should be considered. And we have definitely devastating economic effects as a result of that lack of connection or insight from the different areas. So to conclude and to end up the discussion, I think that we should reconsider and we need to rethink the role of international institutions, the way that governments, transnational corporations and so on engage at a global level. I put a picture there with a globe and money because I was reading recently that better wealth distribution or richer, like those increasing in terms of the super rich doesn't cause poverty. What I kind of wonder about, how is that if you have 1 or 2% of the world's resources concentrated on few individuals, like 1% of those individuals will kind of look and have the power to rule on those resources. What is the implication for the rest? Then what are the government responsibilities when we're seeing this, the reallocation of economic activity, the reallocation, distribution, and the way that wealth is considered, linking to some of the comments that were mentioned as well already, in which way this is going to lead towards social unrest. There is no doubt that this will be on the rise, violence, discrimination, social exclusion, because again, the less developed economies are badly affected. So COVID-19 has just exacerbated existing inequalities. They were there, but now they're worse. And what we see is that poorer countries has been badly damaged, and in particular, COVID-19 have a massive impact in younger generations and the way that they will be able to engage with society, the economy in the future. So what are the lessons learned is my final point. So have we learned something here? Are we considering what we're seeing down there? And are we reconsidering again our approach to it? So thank you so much.
Lucia, thank you very much. You really put us back to the reality because as you profoundly analyze the cost of the current pandemics. I have one comment from the followers of our conference that it's not appropriate to say Chinese virus, but otherwise your speech was excellent. I'm very happy that the next speaker, who is Lucia Sedmiharská from Prague University of Economics and Business, is really in studio. So we can go really straight to her topic, Fiscal Federalism in the Czech Republic. What did COVID-19 pandemics and what has changed? Lucia, floor is yours.
So, good morning to all the listeners. My topic perfectly follows up on Lucia's because she dealt with global imbalances, and I want to focus on local topic, well, Czech Republic and even lower levels of government. But the main question of my research or of the research which will follow is whether we did create new imbalances. Generally, we very often think about government as a single unit, and we rarely take into account how fragmented government or public sector may be. So my research interest for, well, most of my professional life is Fiscal Federalism, which is a special branch of public finance studies which deal with vertical structure of public sector, and it really explores roles of different governmental levels. And the main questions are which level of government should have which responsibilities and how revenues should be assigned in order to be most efficient. Generally, government plays 3 different roles. The first one is allocation, which is in a simplified manner, provision of public services, and all governmental levels have to participate somehow on this provision of public services. Then there are 2 other roles: redistribution, meaning minimizing of inequity in society, and stabilization, which is macroeconomic policy aiming at minimizing the economic distortion, the up and lows of economic cycle. And these 2 functions really belong to the hands of central government. So the question is, how did the COVID pandemic affect our multi-level governance, and what really has changed in the so far very stable and balanced system of intergovernmental fiscal relations in the Czech Republic. Generally, fiscal federalism deals with 4 areas, which is revenue assignment, so the question which taxes are assigned to which level of government, expenditure assignment, which functions or responsibilities different governmental levels perform, intergovernmental transfers, which balance the system so that all levels of government can really perform what they are asked to perform and have sufficient resources. And then additional question regarding borrowing or subnational borrowing, which may further balance the system. As is clear from our experience and also from all the theory we have on fiscal federalism, the impacts of COVID-19 are likely to be differentiated among different levels of government, and these differences depend on how the original setting of the system is done. So knowing these factors, it's very interesting to see how assignment of spending responsibilities and fiscal flexibility has changed the system, and whether it allowed to absorb exceptional stress by different levels of government. Looking at the changes of expenditure structure or current expenditure structure among different levels of government, we can see that regions, well, on one hand, were able to take exceptional crisis measures or finance exceptional crisis measures during last year, and second thing, that they had this flexibility. So they had the flexibility to do it, and they really did it, and the expenditures were extraordinary. Of course, looking at the structure of security expenditure nationwide across different levels of government, we can see that, well, the increase is from low basis. But still, the major conclusion is that regions were able to take necessary action when the emergency occurred. Looking at the same graph but in another scale, we can see that similar conclusion in case of municipalities which were able to support entrepreneurship, which is again extremely important because local entrepreneurs are extremely important for local life, and municipalities were able to take action. The other extraordinary or exceptional increase in current expenditure is mostly related to healthcare, where again, or not again, we will see it again on the later slide, but you can see that the changes among different levels of government were about the same. So the shock was hit all the governmental levels about the same way, and they were able to respond by increasing expenditure regardless the exact assignment of responsibilities in the area of healthcare of the different levels of government. And for social affairs, the change in current expenditure is almost equal across all of the levels of government. So this shows that on the expenditure side, the different levels of government were hit about the same way. They were able to respond. Regarding investment, we see very little change in the structure, current versus investment expenditure. So kind of a surprise, it was, the reaction was will be slower, and probably the drop in investment will come in next year, but for the year 2020 we really don't see any drop in investments regardless the government level. So this is a good conclusion that the system of expenditure assignment showed useful, and we could see that local governments, both municipalities and regions, could react to the exceptional shock, and we don't see any severe disruption on the expenditure side of public budgets. Regarding revenues, the situation is a little bit less positive because we really dealt with exceptional situation caused mainly by adoption of government measures, changes in tax legislation, which strongly affected local governments. There was a number of measures, but it's worth mentioning two key events, which one was in April, approval of law on compensation bonus, which was a special measure to help small entrepreneurs to provide some assistance to those who had to close their businesses or limit their business activities, but it was done through a tax return, which strongly affected total tax revenues. And then a second change was amendment in the law on income taxes, which has very strong revenue impact. What does this mean? First, the law on compensation bonus meant strong fall of revenues. The picture shows municipal tax revenue quarterly, and the comparison between 2019 and 20 shows strong drop in tax revenues, which are major tax revenue for municipalities, and this decline later on had to be compensated through a special transfer, which more or less covered the tax revenue loss. But what is extremely important is that the central government approved this measure without thinking and analyzing in advance the impact on local governments, and the compensation was done ex post as a proposal coming from Senate without any ex ante analysis. A second change was the law on income taxes coming in force from 1st January, which repealed the super gross wage, introduced a progressive scheme, and generally leads to loss in state budget revenue of 100 billion Czech crowns, which is substantial for both state budget and local budgets. It's clear in a similar figure as before, where you can see the drop of revenues in the both, first, the prediction for first two quarters is lower revenues than in 2019, which again has, probably will have to be compensated somehow. These are really very rough and early predictions because several different changes or new situations come into the prediction, so we will see how precise these predictions will be. But for sure, municipalities and regions as well deal with big uncertainty about the further development and the real volume of tax revenues they will get in 2021. So this is important to see that the tax revenue sharing or the system of local government revenues is extremely sensitive in changes in tax law, and due to very low fiscal flexibility on the revenue side, municipalities and regions really are very passive in this regard. On the other hand, we can see that both regions and municipalities are, their budgets are balanced, or that in case of municipalities is in surplus. So generally, local governments show very good fiscal health. On other side, state budget, balanced in the almost balanced in the last years, shows extreme change, and it's clear that the public debt is growing, and that the imbalances on the central government level grew substantially. Well, using the figures on the structure of fiscal federalism, it's clear what really changed. In 2020, the compensation bonus was introduced and subsequent compensation to municipalities was provided by central government, which in the size of the arrows from the original system, which was kind of balanced and which was in force for 2 decades with only limited changes. We can see that central government first provided substantial support to municipalities and had extra expenditures leading to imbalance of central government. So, the sick expenditure arrow of central government shows the imbalance which we will face in the coming years. The rest of the system after the 2020 looks quite balanced. What the next year will bring, or next years, well, it's a question. For sure, it will again lead to further imbalance at the central government level, but we will see whether the local governments will remain balanced or how the imbalance exactly will look like. Well, what have we learned? It's too early to assess the situation, but for sure we see that the long-term status quo was broken, and we will see what will come next. What is important, and it's really something central government should take into account, the system of tax revenue sharing really limits the possibility of central government to realize any stabilization policies through tax policy. Because any changes in the major taxes cause changes in revenues of the local governments, and these changes or drops need to be compensated because local governments cannot bear costs of fiscal stabilization. So this is what has to be taken into account. So far we were not able to observe that central government does it take into account. What we could see that Senate Association of Municipalities were extremely strong in defending the position of local governments and did succeed. Well, little bit exposed, but they did succeed, and they did help to limit the imbalance which would be caused by the original government proposals of the central governments. So this is what we see. We see that we just somewhere at the beginning, and the question whether the system stays stable and how the new stability will look like is still open. And as everybody knows, public finance works with annual data, so we have to wait another year to do further analysis, because looking at the preliminary or monthly data doesn't bring the whole picture. So thank you very much for your attention.
Thank you very much, Lucia. You should know that Lucia is not only speaking from the, let's say, from the chair of the public finance department, but she's also sitting at one of the municipality leadership in one of the district of city of Prague. So it's my great honor to welcome our next speaker, who is Judith Czagi from Budapest Business School. We are happy to have you here. Judith will speak about ECG approach and COVID-19 era. Does connection works?
Yes, please. I hope so. I am sharing my screen. Can you see my screen, please? Okay, just once again, please. Yes, can you see my screen, please?
Yes, we see your screen. Everything is perfect now.
Thank you very much. So, dear colleagues, my topic is ESG approach and the COVID-19 era, the current necessity and future opportunities. And my name is Judith Czagi, and I am an associate professor at the Budapest Business School. University of Applied Sciences in Hungary, and I am honored to be a member of the Academic Council in the Moravian Business College in Olmutz. In 2021, we see investors taking steps towards systemic approaches to reduce COVID-19 caused shocks in the economies and societies as well. And the investments in which ESG-related factors are considered alongside additional financial factors in investment analysis aim to increase return or decrease risk for the investor. Well, one possible solution is the green, social, and sustainable bonds, where bonds proceeds are used to fund projects with possible positive environmental and social outcomes. Can we support this idea of increased return or decreased risk? Well, with ESG investments and with the growing role of the private sector in economic development, voices are calling for ensuring a balance between the goals of profitability on the one hand and protecting the environment and society on the other. As a result, a business model based on environmental and community sustainability alongside returns emerged. That how can businesses contribute to bridging the sustainable development financing gap, which has been established by 2030 at $2.5 trillion United States dollars per year. So based on this and based on the speeches just before my presentation, I structured my presentation as the introduction and economic findings, then the practitioners' opinions, also the results of our own research, and the conclusion part. So by introduction and academic findings, many researchers have supported the ESG investments, and as most of us are familiar with the meaning of ESG, these are the referring to the environmental aspects, the analysis of impact on the natural environment, like water stress, packaging materials, or the CO2 emissions. The S as social is about the analysis of impacts on human society in a broad sense, other human stakeholders, like employees, clients, vendors, or local communities. And the G is as governance, referring to the analysis of the alignment between upper management and the interest of shareholders as the agency program and the law, like when the CEO's pay structure, accounting processes, structure of the board, and the tax compliance are considered. So taking into account the ESG characteristics means paying attention to firm properties that are not directly related to the usual financial or economic performance. They could, however, have an indirect impact on operations, profitability, so that on financial performance that is relevant for investors. We might ask that what could be the underlying factor that ESG investing is growing dramatically? Why is it now? Well, approximately 30 years before, when the Exxon incident has happened, the stock prices barely moved. And today, with the global communication increasing, investors have become less tolerant of corporate ESG incidents. And also we see that investors are demonstrating willingness to act. Due to corporate governance issues, like we remember the Volkswagen company shares had a negative return of about 30% in 2015. Or for example, the Equifax credit reporting agencies' share price dropped by 25% in the same year due to the breach of the privacy and data security. Or Valeant, a large pharmaceutical shares dropped by more than 70% in 2017. After that, the company came under investigation over its accounting and pricing practices. So all these issues have been calling for the emergence of the responsible investor who aims to sustain returns associated with positive long-term outcomes for the environment, society, and business execution. The greater understanding of potential financial benefits led to improved ESG ratings in practice as well. When we consider the effect of ESG to the firm value, we see certainly a positive impact on it. The vast majority of literature support the positive impact of ESG and related disclosure on shareholders' value using common valuation models performance. And this value creation reflects that ESG expenditures and related disclosure play a significant role in value creation in the market, which in line with value-enhancing theory. And also, these valuations are reflected by portfolio managers' portfolio selection, so that ESG standards help informing an efficient portfolio that has an acceptable risk level, assuming diversification. It has been found by academics as well that there is a link between ESG information and the valuation and performance of companies by examining 3 transmission channels within the standard discounting cash flow model, which is called the cash flow channel, the idiosyncratic risk channel, and the valuation channel. These findings have been supported by practitioners' opinions. So each of these transmission channels have been tested by using the Morgan Stanley Capital International's, the MSCI's, ESG ratings data and financial variables. This has showed that companies' ESG information was transmitted to their valuation and performance, both through their systematic risk profile and their idiosyncratic risk profile. So that in short, we can say that lower cost of capital and results with higher valuation, and that higher profitability and is leading to lower exposures to tail risk. So it suggests that changes in a company's ESG characteristics may be useful as a financial indicator, and that ESG ratings may also be suitable for integration into policy benchmarks and financial analysis. So what we found is that the academic conclusions, the conclusions of academics have been supported by practitioners, by large investment bank analysts. We got the results of the MSCI analysts, and this is what I'm going to show in the next forthcoming slides. So verifying the transmission channels in action. MSCI analysts found that better ESG corresponds to first higher gross profitability. So that the gross profitability here as Z-score of size-adjusted ESG quintiles is compounded as the most recently reported sales less cost of goods sold divided by the most recently reported company total assets. So these experts found that the high ESG rated companies were more profitable and paid higher dividends, especially when compared to the bottom quintile companies. Then they also found that the better ESG corresponds to smaller frequency of very large losses. So to assess the ability of companies' risk management functions to successfully mitigate severe incidents that can lead to financial losses, the MSCI experts looked at the frequency of large, adverse, idiosyncratic stock price moves. For each month, they reported the number of stocks that realized a more than 95% cumulative loss over the next 3 years, taking the price at month end as the reference point for return calculation. So as a result, they noted that over the past 10 years period, higher ESG rated companies showed a lower frequency of idiosyncratic risk incidents, suggesting that high ESG rated companies were better at mitigating serious business risk. And by third, this chart illustrates that companies with high ESG rating have shown less volatile earnings and less systematic volatility, in line with the conjecture that companies with high ESG ratings show lower systematic risk exposures. In their ESG ratings, they used the most relevant factors, which you might follow here as split to environmental, social, and governance factors, including the most well-known factors as the climate change-related ones, the natural capital ones, the pollution and waste, and so on. So by starting with the academic findings and then continuing with the investment bankers' opinions, just let me continue with the results of our research. And when we chose to analyze certain markets, together with my colleagues, we chose the very rather volatile market that was the Arabic index markets. And I need to mention here my colleague's name, Adil Salem, Pakistani, and Musab Musa, a Syrian colleague of mine. According to our results, we found that market turmoil occurred soon before and around the World Health Organization announcement on the 11th of March 2020 about the pandemic. In this chart, you may see the S&P Pan-Arabic Index, and that is what we compared with a similar one, the S&P ESG Pan-Arabic Index. So, whereas compared to the previous chart and previous data set, where we compared the companies in general, here we reflected the companies of higher ESG ratings. So compared to the general one, looking at the ESG portfolio, we found that the mean return of conventional S&P Pan Composite and the ESG index was positive, which refers that investors of both markets earned positive return on average. So the markets have corrected after the event of the announcement, after the shock announcement. But what we were looking for is that we were asking about the severeness of the shock. And for that, we used a generalized autoregressive conditional heteroscedasticity model with this test. And so that as many econometricians recommend the Gauge model to analyze the volatility of financial time series effectively, we were choosing this model. And accordingly, so that we wanted to examine the persistence of these volatility shocks. So that the daily market return of the indices was calculated using the first equation, and the mean equation was modeled through an ordinary least square represented in the second equation, and then the equation 3 represents the recondition of the arch effects, which illustrates that the errors are conditionally distributed with variance h. And furthermore, the last equation describes the gauge process in which variance of the selected series is depending on the Lagarde squared residuals and the variance. So out of these equations, just let me summarize the model results, just without going deep into this data. Just in sum, I would like to summarize these results as that to validate the robustness of our models used in this gauge, we performed arch Lagrange multiplier tests to examine the remaining arch effects in our model. Also, for autocorrelation, we performed correlogram of residuals test with 24 lags. The value of the co-stats and the probability value was mentioned also in this table. So our results show that volatility of the stock market is significant in the full period of study for both the markets, for both the pan-Arab composite and for the ESG composite. And these findings suggest that the volatility of market returns is higher in conventional index as compared to ESG index. So we found that the conventional markets were reacting more severely compared to the ESG markets. And the volatility of the ESG index is slightly lower than the conventional S&P index, but both are statistically significant at 1%. And importantly, the coefficient of the arch is significantly less than 1, which implies that the risk associated to both the markets are not explosive in the full period. Well, concerning finally the implications of our research, the S&P pan-Arab composite got significantly affected in the post-COVID-19 period, while the same did not happen in case of the ESG index. So in short, the ESG companies could more easily recover from the shock. So investors earned almost the same mean return before the virus broke out, and the volatility measures were rather the same on the conventional and ESG markets, which implies that both markets suffer risk equally, whereas one of the imperative findings of our research was that we found a significant change in volatility clustering of the ESG Arab composite and conventional Arab composite. It shows that in the post-COVID-19 period, the ESG Arab composite performed significantly better as compared to the conventional one. So, just summarize this presentation, just as conclusions. I think the takeaway message is that there is a certain need for financial return risk-based analysis and decision-making about the ESG investments, and that it's both the academic and practitioner consensus is that the better ESG led to higher profitability and lower risk, and that our results confirmed that the overall S&P index for ESG showed less risky and less persistence values for external shocks, so that it's worth to invest into the environmental, social, and governmental issues. And I'm very thankful for your kind attention, and you can reach me in case you have questions with these availabilities. Thank you.
Thank you very much. This was very interesting lecture. If I can have one question. Oh, we got disconnected. If I can have one question, because in the previous lectures we just saw that there are certain industries which are sort of going up, given by the conditions of the pandemics of COVID-19. I just wanted to ask you if you could in a way comment how the ECG, it's sort of, or how ECG index, it's related to the certain type of industries, and if you check for that factor in your econometric modeling.
Yes, thank you very much for the question. This is going to be the continuation of our research, because the MSCI practitioners found that industries are responding different, and the response is higher in the according to both factors. According to when the economies in general are less positive in implementing reforms, and also when the industry is more conventional. So it's more visible, the change is when within, for example, in the energy sector, ESG factors are implemented. So the next in the next phase of our research, this would be about considering the responses of industries.
Very much. So if you felt so far that we did not get you from your comfort zone, I hope you will change your mind after next presentation by Milan Halenka from University Hospital in Olomouc. I had in mind his topics when I spoke at the beginning about our aim to provide you with inspiration to focus your future research on the needs in other fields of science, and find some disruptive speakers. So here is it. Here it comes.
Dear friends, let me introduce myself. My name is Milan Halenka, and I work as an endocrinologist at University Hospital in Olomouc, Czech Republic. My specialization is thyroid ultrasonography, and the dominant point of interest is ethanol ablation. Why is it useful for endocrinologists to master sonography of the thyroid gland? I have been involved in thyroid ultrasonography for 20 years. At our ultrasound laboratory, we perform approximately 3,000 ultrasonographies of thyroid and parathyroid glands, 300 fine needle aspiration biopsies, 60 ethanol ablation of thyroid cysts and parathyroid adenomas per year. Our cohort of patients treated with ethanol ablation consists of 350 thyroid cysts and 80 parathyroid adenomas. We saved our knowledge and experience in class of thyroid ultrasonography, which were published in 2016 and 2018 in the Czech Republic, as well as in English version published by Springer in 2017. Why is it useful for endocrinologists to master sonography of the thyroid gland? Treating patients with thyroid disease is the most common activity of each endocrinologist. Diseases such as Graves' thyroid toxicosis, Hashimoto's thyroiditis have a characteristic sonographic image. Ultrasonography is the basic imaging examination. It allows you to quickly determine the correct diagnosis even before the results of laboratory samples are available. These results then only confirm these ultrasonographic findings. In the case of palpable resistance on the neck, the examining physician will immediately reveal whether it originates from the thyroid gland or is an enlarged lymph node, or it is a focus of another etiology, and he can refer the patient to another specialist. It is reported that on sonography, a nodule can be found in the thyroid gland in up to 67% of the general population. If the examining physician detects a nodule in the thyroid gland, then his main task is to distinguish whether it is suspicious and intended for surgery, or unsuspicious, and sonographic monitoring is enough. Recognized sonographic criteria are used, according to which the node is evaluated as suspicious. If it is a certain size, i.e. 10 millimeters, it is necessary to perform a fine needle aspiration biopsy. Now I mention an interesting survey of European Thyroid Society. The current online survey of ETA focused on non-surgical mini-invasive techniques in the field of thyroid nodules revealed 92% of endocrinologists personally perform thyroid ultrasonography, 75% perform fine needle aspiration biopsy, 22% perform ethanol ablation, 11% perform core needle biopsy, and 5% perform thermal treatment of thyroid nodule. However, only a quarter of interviewed members of ETA completed the survey. This result already reflects the reality and the fact that about a quarter of endocrinologists is not afraid of ultrasonography, and only a small part of them dare to perform mini-invasive techniques. Why is it like this? Ultrasonography, even with high-quality imaging techniques, is still a very subjective method and requires a certain imagination, a time to gain experience, and gain a certain historical memory of seen findings. To perform mini-invasive techniques, you really need skill, and each doctor will evaluate it himself after several attempts. But sonography is generally accessible method. Sonography courses and study of ultrasound atlases are used to master it. How to improve and simplify thyroid nodule diagnosis? For the diagnosis of thyroid nodules, there is a worldwide effort to use method of artificial intelligence, which would replace just the historical memory of the physician and would tell him, yes, this nodule is suspicious. We will try to put our skills into the research of the classification of benign and malignant thyroid nodules based on transfer learning and a convolutional neural network. The aim should be to create a simple and fast program accessible to routine outpatient endocrinology practice. And now a small sample of our ultrasound figures from our atlases. Figures of small thyroid carcinoma with typical ultrasonographic figures and demonstration of successful ethanol ablation of thyroid cyst and parathyroid adenomas. The first case is small microcarcinoma. You can see small hypoechoic nodules with 1 microcalcification. The second case is small carcinoma size 15 millimeters, hypoechoic nodules. The third case is small papillary thyroid carcinoma, hypoechoic nodules with 2 microcalcification and taller than white shape. And the last case are 2 follicular carcinomas in the left lobe of thyroid gland. And now demonstration of successful ethanol ablation. In the left figure, you can see thyroid cyst at volume 11 milliliters. In the right figure, you can see the same cyst 6 months post ethanol ablation. The cyst shrunken into small solid nodule volume of 0.3 milliliters. Here is patient with primary hyperthyroidism. In the left figure, you can see parathyroid adenoma volume of 1 milliliter. In the right figure, you can see the same adenoma 3 months post ethanol ablation. The adenoma gets shrunken into volume 0.1 milliliter and the laboratory dropped totally to normal. Thank you for your attention.
If you wondered why thyroid issue is related to COVID-19, there is the answer. Because during COVID-19 pandemics, we all have seen the need to work with medical doctors' capacity more efficiently. And here is one of the issues presented by the medical expert, which needs the contribution from other fields to find the efficient solution for the healthcare system and get the benefits which were mentioned, for example, also by Ron from Israel when he called for the solutions for his home hospitals. So this was the last presentation in our first session, Socio-economic impacts of COVID-19. And I would like to ask Rector of Moravian Business College, Jarmila Civilmanová, for concluding remarks on the heterogeneity of this session.
Thank you. I must say that I enjoyed all the session, and you can see that the range of impact of COVID is really huge, because we have heard presentation focused on municipal level, on company level, on global level, and a solution of all of these tasks are not easy. And I think the main message from this session is that we should cooperate. We should cooperate internationally, and we should cooperate not only economists together, but all experts from all various scientific fields to solve such not easy economic and social tasks.
So thank you very much. So those were the last words. Thank you everyone for your attention. Now it's time for coffee break. You could be drinking coffee the whole time, but we here also need one coffee now. Have a nice day.